Anna Patel. I'm a GP at Dr CM Patel Surgery, and I'm Vice Chair on NHC. So thanks for joining. Just to remind everybody that the meeting is being recorded. There hopefully should be plenty of opportunities to ask questions. I will do my best to keep the time. But if you do have any questions, if you could put them into the chat bar. And can I kindly ask that if you're not speaking, if you could mute yourself, please. Right. So just one thing I'd like to mention. I know that some of us have had a tough week where we've been left with our internet. So we've lost our main internet source going into the practice. So I was one of the practices that was affected. And we've literally just got on with things. So we didn't cancel any appointments. We booked in everybody that needed to be seen. I've gone to the old school writing. I've been writing in patients' notes on pieces of card and then transcribing it later on. We've made sure all the prescriptions have gone, but I was a little bit disappointed because I found out through an email on Tuesday evening that there was a problem. So up until then, I just thought, oh, it's an EMIS thing. And I just got on with things. So we had a problem on Friday and Monday, then Tuesday it was really bad. Then Wednesday there was nothing at all. Everything just stopped completely. So it affects so many things. But I'd be interested. I know that Tammy has raised it and she's put it into one of the GP WhatsApp groups that just to feed back what issues that practices have had and how we've managed it. But I think collectively as GPs we've done really well to get on and still provide services to our patients. But I think that going forward, something like this, it shouldn't be happening in this day and age. So there should always be some sort of system in place. So I don't think that it seems like something's gone wrong somewhere, but it's not very clear to me what's gone wrong. So I'm quite interested to find out what's happened. Aklasur?
Hi, everyone. Yeah, just to give you a brief update, I can't give you the technical jargon in terms of what went wrong. It's just I just don't know. So we found out on Tuesday as well. Later on, I've been working with the IT team trying to sort it out. They came with alternative solution, and they've been sending out comms and keeping updated. So hopefully once there's a solution that's in place and is sustainable throughout, and the IT guys are working on it. I will touch base with them just to get an evaluation in terms of what happened and how we could have prevented it, just to do a bit of learning.
Yeah, no, and I think that's really needed. I mean, if I have one laptop that we've been sharing amongst all staff. I just sent the admin staff home. There was nothing for them to do. So I think that the fact that I had to then ring around to say, can somebody give me a laptop? I fortunately was given one by NHC, but I think that should have been the first thing that the IT team could have done. Is I know it may not be that they're just sitting there, but that's something that could have been done from the IT team side, in my opinion. Rima?
Yeah, I agree with that, and I can see that there have been emails as well sent from Osman, who sent emails to practices across North East London to ask as well if they've got any spare laptops that they can pass to practices. And I mean, it's just, yeah, you're right in that the way this has come about in terms of that cascade of communication, and just another example of where it just hasn't gone right. But I can see that Osman's put in an email as well that to contact Chico as well, because I think they're trying to source his laptops from other practices. If there are any practices that do need that, then please just email Osman or Chico.
Max?
Would it have been something ICB IT team response side, a backup Wi-Fi, a spare Wi-Fi at the practice would have helped?
But there is a backup line, but the issue is the backup line is not fast enough to support EMIS.
Oh no, something completely separate to what you use already.
Yeah, so there are backup lines in place. So this is my understanding. So again, I don't know all the technical stuff and all the jargon and everything, but there is a backup line, which is what we are running on at the moment.
Okay, so
my team will work fine, but EMIS doesn't. EMIS is, the circle of the circle going round and round, but the internet is working fine, sorry, but EMIS is not working as fast as it should or could.
Okay,
So basically the backup line isn't, it doesn't have the required bandwidth to actually operate, and that's where I'm a bit concerned with, because the backup is there to actually back everything up, and that's what we'll be picking up with IT.
When we lost power and we lost the power unit in 2016, when we reflected on it, we got a completely separate Wi-Fi that sits aside. We hook up a few things to a separate Wi-Fi. So like our alarm, for example, our security cameras and systems hooked up to that separate Wi-Fi. So if the main Wi-Fi ever goes down, we do also have another line. It costs £30 a month, but that was the only way that we could see around it, because and running our laptop. So we were definitely able to run our laptops off the completely different provider, basically. Just some food for thought when it all gets kind of played out. There's stuff that we have in our control, and there's stuff there is that absolutely the IT team need to be able to, and that's no excuse for the response times or anything like that. That's something absolutely that needs to be addressed.
Thanks, Max. Martin?
Hello, everyone. Hello, my name is Martin. I'm the clinical lead for IT and digital transformation. Just wanted to add a few comments. First of all, I do think the experiences that practices had in Newham has been unacceptable, and I think that you've shown great resilience in ploughing ahead. Just wanted to comment that the NEL IT team have been working quite hard to try to resolve the issue. And just to clarify, without getting too technical, there are two kind of lines that are there that can pass the data. Both are run and by a third party called Naystar, and one of the lines ceased. I don't quite have the reason right now for why that line ceased, and hopefully everyone in Newham can get that information, because I think that's paramount and really important. The second thing is, it does raise a really important question about the backup line, and that's something we need to really follow up on, because the backup line being unable to carry the data and have the bandwidth is clearly not acceptable in this situation. And I agree with Wax, it's important for us to sort of have our own backup, but then practices were not made aware of that. The final thing really is the sort of communication and response. And even myself, I only realized the extent of what had occurred and the amount of practices that were affected on sort of late Monday. And a lot of that is because a lot of you just plowed ahead and didn't really, you just created your own solutions. However, the communication to practices could have been a bit better, so that you could have provided a response to your own patients, let them know about your reduced capacity, which may have helped you all to handle the situation a bit better. In addition to that, one of the final things is sort of learning from this situation, and there's a big question about the overall response. And one of the things I'm going to be doing is working with Nel and Rima, is to be reflecting what's happened, see what could have been done differently. Hopefully once the solution is resolved, for example, how many dongles do we have? Why couldn't we, release laptops out quicker, etc. And my contact and email is always open, and please do email me, because as much input and feedback and thoughts from yourself would be really helpful, especially when I'm feeding back to Osman and the wider IT team. Thank you.
You're on mute, Arpana.
Sorry, I said Sharif and then Tammy. I'm just a bit mindful of the time. I was apologising to the other speakers.
Hi, guys. I just wanted to reflect on the difficulties that we're facing at Newham Medical Centre So again, we haven't had much communication about what's going on. It's now been 1 week. We've been struggling really hard, both admin level as well as clinicians. Even logging on remotely using laptops, it's not working. The whole system is really slow. I've been online until midnight last night trying to file. I've only managed to file 6 documents and sign 30 prescriptions, and there's hundreds sitting there in my inbox. So that's logging on from home. And even my admin team are logging on at 8 in the evening, trying to get this work done, just so we can run a relatively safe service. I am a bit concerned how safe this is going forward. And we're getting a barrage of abuse at reception. People are walking in when they're told on their phone that we're having IT issues. They're walking in to demand their drugs, their letters, many things, and they're getting abused left, right, and center in reception. We need to get some level of communication out there from ICB to the population. We need posters or something. I don't know if this is going to go on for another 2 weeks. We need information that we can put somewhere for people to see, because we're really struggling. And we're thinking going forward whether we need to cancel all our clinics and deal with emergencies only and redirect patients to A&E. I don't know. We're stuck. We're really stuck. Thank you.
Sharif, for sharing that. I think that we've all got our business continuity plans, but I think that the issue that you're highlighting is that we don't know. We're not clear on how long, and that's the biggest issue. That is it going to be another day? Is it going to be a week? Is it going to be 2 weeks? So I think even just having some idea of how long this problem is anticipated to go on for would be helpful. Tammy?
Thanks, Arpana, and I'm so sorry to hear that, Sharif. It's just awful to hear. So I've got a little bit of insider knowledge because my brother does this for a living and works for Vodafone, and I think there's a couple of this is a significant event because there is nothing that identifies us as being a priority as GP practices in the cabinet. So BT, whoever's line it is, doesn't recognise that we are different to the residential people around us. So unlike the police or unlike schools, we are not protected. So that is something that the ICB really needs to work with BT and NASTAR to sort out. And the other issue is that we don't have fibre optics into practices, so it's going and converting into copper cables, and that's slowing our signal down. So all of the problems that we're having with slow EMIS could very well go back to that. And obviously the company wants to upgrade, and so this is part of the problem. They unfortunately accidentally cut the copper, which is prescribing those particular practices. And what we don't know is the knock-on effect to other practices. So it's really important, as Martin said, to highlight early if you are having difficulties. And as much as we've all got business continuity plans, actually I want to ask NEL ICB, what are they going to do? What's in their business continuity plan for when, sort of 11 practices and possibly more could go down across North East London? What is the solution? Because if we've all got the same provider, then this potentially is going to happen. Is it that they need to go and get quotes from other providers who have the infrastructure to support us? Those are questions, Rima, that we really need to ask. And as they're going around and doing site assessments, they should be also getting in quotes, because this is going to take a while for us to unpick. So we need to deal with the acute problem. I get that, and have some workaround solutions. But ultimately, if this is the network changing from fibre to from copper to fibre, then potentially that could impact all practices. Thank you. Oh, and do feedback. So I'm away for 2 weeks, but please do feedback to your LMC reps if there are any issues, or indeed email Elliot directly. Thank you.
Thanks, Tammy. Can I just ask Aklasur if you can be brief, and then Manuel, can you put your comment in the chat box or come to it at the end? I'm just a bit mindful that I would like to actually start the agenda.
I'll be very brief. With regards to Tammy's comments, I can ask that question to IT and see what response we get with regards to the cabling issues, etc. In relation to Sharif around the comms, we've already asked comms to do comms to patients around the issues that we're having. So hopefully that gets sorted out as soon as possible as well.
Thank you. Right, so if I can go back to the agenda, and for those of us that wish to discuss the IT issue further, we can do it at the end, if that's all right. So the first speaker that we've got is Dr. Sood, who's going to be talking about BBV and chlamydia gonorrhea screening. Thanks, Dr. Sood, for bearing with us. You've got about 10 minutes or so. So over to you.
Thank you. Can everyone hear me? Yeah. So firstly, I'm going to apologise. It's actually my day off, and my granddad passed away this morning, so I'm sitting in a coffee shop. So if there's any background, that's what it is. And this would not normally happen. I do apologise. And I will keep this brief. Don't worry, I'm not even going to take up the 10 minutes because it would be nice to just have a chat at the end of this. I'm Chandni, for those of you that haven't met me. I'm the primary care liaison lead for a sexual and reproductive health act, and I'm covering Newham, Tower Hamlets and Waltham Forest. You guys might have remembered Jane Hutchinson. She used to be my role back in the day and then retired. And I've taken over her and a bit of Jill Zellin. And you might have received my newsletters and things. I've sent out 2 so far since I've started. The talk was meant to be on BBV and chlamydia gonorrhea screening. Jyoti, Commissioner, is going to touch on that. In the meantime, I firstly wanted to sort of give you a brief overview. The screen's not. Oh, there we go. Just to say that you may or may not know that gonorrhea is up by 50%, chlamydia 24%, and syphilis 15%. And actually, one of the main things the government wants us to do is improve partner notification. Now, that lies with secondary care. I completely accept that, appreciate that, and we deal with all the gonorrhea, syphilis, other infections. This is more of a reminder that when you're doing chlamydia gonorrhea screening in practices on your NATs, whether the patient's symptomatic or asymptomatic, anything that isn't chlamydia gets referred via email to sexual health form to the sexual health. If it is chlamydia, that is in primary care. If you've tested them with a week of doxycycline.
Dr. Sood, you're breaking.
Needed. Now, with just a reminder to say, if you are going to treat someone with 7 days of doxycycline for chlamydia, you have to remember to notify. Yeah. Let's just do that.
Chandni, sorry to interrupt. I don't know if it's just me. We can't hear you very well. So, are you okay to turn off your camera?
I've got rid of my headphones.
I think it's the connection. So maybe if you turn off the camera, that might help.
Is that any better?
Yes.
Or I'll just log in on my phone. Hold on.
No, that's fine now.
Is that fine? Okay.
Yes, fine. Thank you.
In summary, if you're going to treat anyone for chlamydia in the practice, then it's 7 days of doxycycline, and remember to partner notificate those patients. So make sure that their partner is treated before they go and have sex with them again. Otherwise, we're just passing on infection. We've had a few cases where patients have been treated in the community for gonorrhea with azithromycin, and that's incorrect. They've got to have an IM injection, a test of cure, and all of that's done in the sexual health clinics. It's a reminder just to refer on to us. Here's a quick list of the things that we see in sexual health. So any STI related care, partner notification, persistent discharge. If you've got someone recurrent thrush or BV, please just send them in. We'll probably need to test them for Mycoplasma genitalium, and we'll happily see them. PEP, PrEP, genital dermatology, refer to dermatology, but get our opinion in the meantime, because you'll get that a bit quicker. And complex contraception. Now, you're going to say to me, your patients can't get an appointment. And I can't help completely with that. But what I want to highlight on this is, can you see in the middle, it says advice and there's an advice email address. Please, 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 that's me and my secretary. Please just email us. I reply within 24 to 48 hours if it's non-urgent, and I'll book you an appointment if necessary. And obviously get the patient to try firsthand, but if they can't, I'm happy to help. And then you've got the referral email. So if you know it's a direct referral, you don't need to speak to myself or a clinician, just refer and we'll sort them out as need be. Look, I'm here to try and bridge the gap between primary and secondary care. And this might help, I guess. And I know it's really difficult for patients to get an appointment. I know it's really hard for you guys to get advice. There's some things that I can't change about the NHS, but look, if the advice email is something you can use to get in contact with me about anything, I can help book your appointments, refer on, and do anything in-house I can do to help. I also put this mind map together, and it shows all the different Orly services, the email addresses, times they're open, what they offer. So I'm hoping that's really useful to you. And I really hope you did receive this back in September in the newsletter that I sent round. And then there's another newsletter that went round last week, and it's got lots of information on there. Jyoti's going to take over. But the other thing I want to say is I can also help with LARC training. So if anyone wants to become coil or implant trained, GP, nurse, physician's associate, anyone, get them in touch with me. I'll walk them through the pathway and try and skill them up. Physician's associates, I'm unfortunately not going to skill them up on coils. It's a difficult subject, but implants most definitely. That's me, and I really, really do apologise for the fact that I'm doing this in a coffee shop. Jyoti, if you want to take over.
Dr. Sood. And just, I understand you may need to leave, but thank you so much for joining us, especially when you're going through this difficult period. You're another example of how we all just, as clinicians, as doctors, we just get on with whatever we have to do. So we appreciate you joining us today, and condolences on behalf of myself and my GP colleagues.
Thank you.
And if you need to leave,
I mean, he was 97. It's a celebration of life, but yeah.
Thank you anyway for joining us. Jyoti?
Hi everyone, I'm Jyoti Singh. I'm a public health commissioner and leading on the GP public health contract for Newham Council. And I just wanted to very quickly touch upon BBV screening. I think NHC has sent out that communication that we have put BBV screening on hold. So the new contract, which started from the 1st of October, included BBV screening, which basically meant that, we were replacing HIV screening with BBV, which included, Hep B, Hep C, and syphilis. And basically it was like, a combined offer of HIV, Hep B, Hep C, and syphilis. Unfortunately, there have been some issues with the sign-off, so we're waiting for the final sign-off. And as soon as that's done, we will send out the comms. But in the interim, we encourage all practices to continue offering HIV screening to new registration patients, as we've done in the past 5 years of this contract. So that's about BBV screening. And I also just very quickly wanted to touch upon LARC. So Newham Council is quite committed to reducing unintended pregnancies by offering by improving the information and offer of contraceptive choices to our residents, particularly in primary care. We have given a bit of an uplift to LARC tariffs in primary care, and we're also encouraging practices to set up as LARC hubs to have inter-practice referrals. NHC have sent out that comms in past, and I think we will continue to do that in collaboration. But yeah, basically we're really encouraging practices to become LARC hubs. The aim is to actually have one LARC hub per quadrant, and I'm happy to report that Wood Grange is one of the first LARC hubs. I think they started providing LARC from the 26th of February, which is great. And so that thing is going on, but we're also looking to set up LARC hubs in quadrant 2, 3, and 4. And I'm really, really, happy to have these conversations with colleagues. So yeah, that's a little update about LARC. And any questions, please do get it. I'll put my email in the chat. Please do reach out. I'm really keen to have these conversations with you guys.
Can I
Thanks,
chip in,
Jyoti.
Arpana? I did this quick
Sure.
slide because I gather there were a few questions about what had happened and why one practice or another practice. So really just to give you a chain of understanding, colleagues, about what had happened. But the main point really, as Jyoti and Dr Sood have said, is we really need new sites for the LARC implants. So really just to encourage, in an ideal world, we'd like another 3 to come forward. And I know there have been some conversations, and I know some practices are still reviewing it, but especially given the offer from Dr Sood about training and support, I just would be great to discuss it further with practices that think they might be interested.
Asma, I think you were going to come in.
Okay. Yes, I didn't want to miss Dr. Chandni Sood. So, Dr. Sood, could you please just briefly inform all our clinicians here about the recertification of the LARC and implant qualifications? Because we know across the borough, we have many clinicians who had the qualification, but they need a quick recertification. So if you just inform everyone about the process. Please.
So it's really difficult to do that on as a brief summary for a revalidation. It's individual, like it depends on how long it's lapsed for, how many coils and implants they're fitting. And that's why I've said, please just contact me. I'll set up a quick Teams call with the individuals, go through what they need to do. Because actually, not in a bad way, but if someone's not fitted a coil in 10 years and wants to recertify from tomorrow, my question first is going to be, how are you going to keep your skill up if we recertify you now for the next 2-3 years? Because it also, you can't be fitting 1 coil a year. It has to be safe for the patient. So I think each of those would be individual. Just get in contact with me and I can help with the recertification. For anyone that needs to be trained, again, I'll help you through a poster. The costs, obviously the training from us would be free. In terms of, you have to do one open book exam called the OTA exam. And the thing I would stress to anyone thinking about becoming LARC, it's an open book exam. I will sit you down and I will show you exactly what things you need open to pass that exam, and the basics that you need to know. Don't be put off by an exam. We can help you through it. If you want to be trained and your practice is supportive, please just come forward. It's worth the chat, isn't it?
Thank you.
Thank you. Right, thanks. So I think Dr. Sood's put her contact details, and the other slide that had all of the clinic information and the contact details will be shared by the NHC team later on. Okay, so the next item on the agenda is some updates from Paul.
I think I'm going to do it, Arpana, if that's okay.
Oh, okay.
That's fine. Paul is with us, but just in terms of sort of trying to catch up time, I'm going to try and be quick. It was really just, if we just quickly whip into the CAS update, colleagues will know we've been supporting the same-day urgent access referral process with our clinical advice service, which is what the CAS stands for. And just to give you some updates on the volume of appointments that are going through that process, you can see the December and the January numbers. What we're seeing is an enhanced utilisation of those appointments and an improved management in terms of face-to-face and online appointments. So hopefully that is feeling positive in terms of practices not getting quite so much pressure for urgent access appointments. If we just move on to the next slide, we are seeing approximately 10% of appointments dealt with in face-to-face, and we're working in conjunction with different hub sites. So in South One, we work with the PCN on delivery. In some of the other parts of the borough, we've got hub sites that are doing those face-to-face appointments with us. And then if I just move on, we are about to finalise the adoption of Adastra in the CAS, and once that goes live, we will be able to manage the GP Connect appointments through the CAS. And fundamentally what that will mean is that we can help increase that utilisation, and also hopefully improve that the referrals that reach practices for face-to-face appointments are more appropriate, rather than some of the referrals really reflecting issues that weren't urgent or in need of a face-to-face contact. So we are about to roll out that GP Connect activity, and we'll be sending a note out to all the practices about how that will work. Fundamentally, it won't change the way in which you already liaise around the GP Connect appointments. It's just that our clinical assessment service will do a consult and treat option within the middle, which hopefully, as I say, should manage an awful lot of the appointment for you. And I'm happy just to pause there, if that's all right, for a second, Aparna. I see Manuel had a question.
I love that hand up.
Sorry, I just want to ask a simple question in the light of what has happened with some of the practices not having any network connection, unable to. Is there any flexibility or provision within this same-day access contract to support these practices on when things go wrong like this? Because for a large practice, switching back to Lloyd George notes as a business continuity plan, it's the nightmare, and that is a step probably too many backwards, considering the enhanced access, same-day access, and all these provisions and the technology that is available. That's my question.
Thank you, Manuel. It's probably best answered by Aklas, so I don't know if you want to pick that up in your contribution when you talk to us in a few minutes, Aklas, because fundamentally it's about the contracting environment. I mean, you know, on a general level, you know, NHC would try and do what we can, and I know we've been able to support some practices with PCs and trying to help rearrange hub sites where they're doing enhanced access and so on. But the contracting to include a backup for this sort of facility would really be a commissioner decision. Shall I leave that for Aklas to pick up in his, because he's going to give us an update in a few minutes anyway, if that's all right, Aparna?
Yeah, that's fine.
But just going to whip on to the, I'll just whip on to the acute respiratory hub, and really just to remind colleagues that that service is still available, and it will be available until the end of March. It's focused around children, as I said, with acute respiratory infection, but you can refer directly from the practice. There's the telephone number identified there, and the service is open from 8 a.m. And all the appointments are face-to-face. So please do make use of that service. It's there to bring some additional support around ARI to the practices. And that's it for me, Aparna.
Okay, great, thanks. Any questions with regards to this acute respiratory illness service? Amy?
Thanks, Karen. I just wondered, what's our uptake like? Because I'm not necessarily sure. It would be good to have some feedback about that, because if it's that we need to better contact out to receptionists at our practices, then it would be really helpful, because I'm not necessarily sure they're always remembering, even though I've written it up at the board. I've written it up on the board at the back of our reception. So yeah.
Paula's on the line. Paula's a bit full of cold, which is why I've done the update on her behalf. But Paula, can you give Tammy any sort of info?
She's put it in the chat. She's put it in the chat.
Right, so utilization is about 90%. There we go. So pretty well used.
It does vary day to day, but we're seeing on average around 90% on a daily basis currently.
It sounds like your practice, Tammy, and others are probably using that back of the practice sign and doing it. But equally, it is there till the end of March. So keep going, colleagues, and you know it's there to be of help.
Great, thanks.
Pass it back to you, Aparna.
Thanks. So, and over to Aklasur now for a now update. And I think if anybody has any other questions, you can answer them at the end of your bit.
I can try and answer them, thank you. So I'll start with regards to the contracting arrangement for the backup. It's a valid point, I guess, but it's something that we just need to better understand what the extent of and the lead time that would be needed to sort the current issues out. So it's something that we'll be picking up with IT and find out what the lead time is to actually resolve it. It is something that we could look into, but it's not something that I'll be able to commit to anything now, but we will look into it. So a couple of other updates in terms of primary care. One is the first one is related to the 24-25 GP contract. We are still waiting on announcement for any updates. Hopefully, we're hoping that we'll get some sort of updates by end of this month, and then we can come back, give you a little bit more details around that. Second update is related to the enhanced service list for 24-25. So new outcome measures and the service specification has been agreed. This will commence from 1st of April, and practice and PCN would have received comms related to these services previously, but there'll be further comms coming out by the end of February. Next slide, please. There are 3 specifications that are being discussed at the Newham LIS working group. This is around LTC mental health and vulnerable children MDTs, which is a new spec. In the next transformation group, there'll be 2 specifications that would be discussed around diabetes. In terms of spirometry, we are waiting on final confirmation from PCNs, whether they'll be providing the service or subcontracting. Checklist has been provided to PCNs regarding MOUs, which will need to be in place with the preferred provider. Service can commence once the government's arrangement has been approved by ICB. All other service spec will be rolled on into 24-25 with notice for any possible changes in year. Those are my 2 updates relating to primary care. If there's any questions, please let me know.
You've stunned everybody. Everybody's stunned to silence.
Brilliant. But with regards to the IT issue, like I said, I'll wait until the end of the meeting, collate all the information. I'll ping an email to IT and get an update in terms of where we are and pick up all the issues and questions that we may have.
Okay, thank you. That will be much appreciated. Okay, so is Danielle here and Andrea? So they're going to be talking about the NHS Diabetes Prevention Programme. Let me just check if she is here.
I think we're running 10 minutes ahead of schedule, so they might not have joined yet.
No problem. So is there anything else wishes to raise now? I know that Manuel did your question. I know I didn't let you speak up before.
Okay, couple of questions.
Yeah,
one of the questions is on the sexual health contract or the hubs for the LARCs. Is there any support available for us to set it on the eHub, EMIS hub, as a PCN, which we are rolling out? Because it's a new system and templates and inter-practice referrals and all that. Is there any support for that? The second question is going back to the issues with the practices who have lost their connections is, just to give you a background, is I used to be a BT engineer and I was part of the project for fiber optics in Heathrow Airport and Canary Wharf. So I do understand how these things are rolled out. So no engineer wakes up in the morning and says, I'm going to cut these primary lines. Okay, so the first thing we all know, there must have been an order placed somewhere for some work to be done on these lines. Second question is, were the practices informed that something was going to be done on their practice line? So they should have been aware of it. And then my third question is go back to what Tammy was saying, is NHS network classified as a high priority secure network? Because normally there is what we call with the police and other defense system, we have a disaster recovery network, which has a routing completely separate from the primary routing to secondary, which can be switched straight away to connect us back. So these are my questions. Sorry about the technical questions, but we are also provide very I wouldn't say mission critical, but critical care for our patients.
So, Bhupinder, you've got your hand up. Are you going to answer Manuel's questions for us?
I'm going to ask another question when somebody's answered his questions.
Yeah, I think that, some of these things that I think they're things that need to be taken back, because, some of us may have an understanding. The email that I got said that there was a mix-up. It says, as you are aware, I wasn't aware, but due to a mix-up in the primary and backup line numbers, 11 GP practices within Newham found their primary lines had been seized. The system fell to the backup line, which did not have sufficient bandwidth for the full operation of the practice. That's what we've been told. So that something's gone wrong somewhere. But I think that all that can be done at this time is we need to just have a quick fix or something that can allow us to continue our services. But I think that what you could do that would be helpful to us is note down these questions that we're all asking and get us some answers. So and to help us to stop, this can't happen again.
Absolutely. It's one of those things that I would want to pick up, but I think for now it's all about let the IT team sort it out now so that there is a solution in place and we find the solution as soon as possible. And then the next bit will be about trying to understand how this has happened, what process and governance did it follow, what comms were shared, etc. Because you're right, Manuel, if there was a planned work to be done, why wasn't this shared with practices? Because those lines are connected to those practices. So that's what I would want to ask. But we can pick up, because a lot of what you said is very technical. I do apologize, I don't understand some of it, but we can pick it up towards the end, and I can take those questions away and get them to provide a response.
Thanks. Bhupinder?
So my question is, it's essentially, I think it was a cost-saving exercise, because there's a money problem. So the backup line was supposed to be disconnected because it was hardly used, so they decided to cut it. But accidentally, the NASTAR engineers put the main line number on the order sheet to BT. So BT shut the main line instead, leaving the backup lines. So my question is this really a good way to save money? There's maybe other ways to save money, considering the critical nature of general practice or any organization which is pretty much 100% digital and not being able to operate. The number of appointments that have been lost in the last week would go into several thousand across 11 sites. And then to add insult to injury, another practice went down after the first disaster. So some significant event needs to take place, some significant event inquiry, and some learning needs to be made so that reassurances can be given that primary care isn't cut off again in this way. Sorry, I'm just expecting you not to answer it, so just to be the messenger.
So I think Aklasur's noting things down, because I think it's unfair to expect you to answer all of this. Martin, no. And then we'll move on to the next item.
Yeah, I just wanted to sort of echo Bhupinder's point. I think Usman has kind of reached out with correspondence as well the last 2 days. I think what is really needed for the Newham community is a sort of root cause analysis, and just clear transparency over what's gone on. What I've been fed back is exactly what you mentioned, Aparna, but it sounds like something else may have gone on. And I think for practices to be reassured, we need to really have that clear transparency. So I'm going to sort of liaise with Usman to see if that can occur. That's just one thing I wanted to mention. Thanks.
Thank you. Right. Thanks. I think if there's anything else, we can email you to gather that information. Yeah. Thank you.
Yeah, sure.
So Danielle and Andrea are here to talk to us about the NHS Diabetes Prevention Programme. So thanks for joining us, and over to you. Bye.
Thank you. Thank you for having us. I'll just do a little bit, I'll do an intro to me and then obviously Andrew will do one. I'm Danielle, so I'm the Engagement and Partnerships Manager for the new NDPP service for North East London.
Thanks, Danielle. And I'm Andrea Coleman-Cook. I'm the Service Manager for the NDPP across North London.
So I'll just, I've got a couple of slides obviously to go through, so I'll do those and then we can perhaps, do some Q&A. So we are the new providers, obviously. Thrive Tribe is who we are. We are new to sort of the North East London area, but we're not new to NDPP. We have been delivering the services before. Ooh, so I was trying to click it on and it's not me that's it's not me that's doing it. If we could move to the next slide. Yeah, so we are experienced obviously in healthy lifestyle services. We've been delivering sort of behaviour change interventions for the last 15 years in stop smoking, weight management, health checks, and our mission obviously is to empower over 1 million people to change. Now we've taken on these new services. We're definitely getting near that. This is the figures here will be a little bit older now. So to date, it's well over 328,000. So we're on. Now we've got the new services. We'll definitely be pushing towards that million soon. Next slide. So we are new kids on the block to this area, obviously northeast London, southwest, southeast. We are new to this area, but not new to the service. We've been delivering the service in Cornwall and the Isle of Scilly, and we're also delivering it as well in Derby and Derbyshire, and Peterborough and Cambridgeshire. We've mobilised 6 new services, including obviously the 4 in London, 4 ICBs. And we will be delivering face-to-face intervention. I'll go into sort of some other offers that we've got, which may be new, and you're not used to. But our face-to-face diabetes programme in Cornwall has the best adherence in the country. So we're really proud of that. It's really good for that people are completing the courses. NHS England have also cited that our quality of data is the best they've seen. So that's good, again, for you guys getting that data back. Next slide. So our programme. So face-to-face one, similar, I would think, to the previous provider. Group session where people will attend. And so they can join that obviously when they get referred through the GP clinical system. They'll get a one-to-one or a phone call from one of our health coaches, and they'll be able to choose one of these interventions. So they can do a face-to-face. They can do the digital offer, which is an app provided by Second Nature, so they can choose that option. We're also working on some tailored remote ones, so specific cohorts. So at Southeast Asia, we're doing working with the RNIB. We're also working with, I don't know if anybody's heard of the Deaf Nigella, but we're working with doing a British Sign Language session, which is really good that we're working with her to do that. So hopefully we'll be able to sort of cover everybody's needs. Next slide. What's changing? New referral form. Yeah, it's live on your clinical systems. Any problems, obviously reach out. We can, I'm sure if you can't find it, if you can't find it, we haven't been able to find it, got any problems with the form, reach out to me directly, and I'll be able to hopefully sort that out for you. New team. We've got a whole new team, obviously. Me and Andrea. We've got health coaches that are new. So yeah, we're all fresh faces to this area, of London. We are a new provider, but it's a similar sort of process, but different programme. We are working at the moment at rolling out new programmes. So any GPs, any spaces that you've got that we can use. We need probably a space that we can comfortably fit up to 20. There'll be no physical activity element to it. So if you've got any space that you think we could use, that'd be really good for, if you reach out to me and let me know. Next slide. obviously you've seen this before. This is the clinical operating system form, so it just comes through to our NHS email that you can send that through. So that's how to refer. And then we've also, people can self-register, but what that does mean that it still needs to go hand in hand with the referral. Okay, it still needs to go hand in hand with the GP referral. So even though they can self-register, they still have to have that HbA1c proof. So they need to upload that. They will need to their NHS number, things like that. So if they can self-register. So if you click through to the next sort of bit, it will just come up with the self-register link. So that you can go to the website and they can self-register, but again, they will need their NHS number, their relevant blood test within the last year, in order to self-register. And what that means is that they can then go in and pick which session they want. So, and then next slide. You guys know this eligibility, obviously between 42 and 47.9. And also gestational diabetes, any history of gestational diabetes, they are eligible, and their blood test, like I said, just within the last year. So that's that, and they have to be pre-diabetic. And the exclusion criteria: pregnancy, if they've got type 2 diabetes already, or if they were pre-diabetic and now they're type 2. Obviously, they're not eligible. Anybody over the age of 80, but it's clinical judgment with that one, because we are still able to process them if they are over 80, as long as you've put that through, your GP clinical system. So we still can put those referrals on. Bariatric surgery in the last 2 years, and an active eating disorder. So that's us. I think that's probably it for my slides. If you click through, I think that's probably all my slides done, right dear. Oh, just some areas that we've started in already, but again, we're rolling these out all the time. We're still sort of in the latter stages of mobilizing. So yeah, these are kind of areas that we've started or starting sessions. So yeah, just keep referring. Contact me if you need, for any queries, any questions. I'll pop my email address into the contact details. And if you've got any space at your, that we can use, let me know as well, because that'd be really good. Thanks, everybody. I think that's probably it. Any questions?
So with regards to the spaces,
yeah,
Vicarage Lane Health Centre. So there's a message in the chat.
Ah, great. Let me write that down. I'm going to go to the chat. I'm going to write this down. This is great. Yeah. Ah, yes. Vicarage. Thank you.
I have one question. Will you be sharing out any booklets? Because I remember we used to have a really good booklet that we could hand to patients when we would see them for a pre-diabetic review.
Yeah.
So any resources like that would be useful.
That's great. So what I'll do, I can send you, I can put a link to my email address, and then if you send me an email, what there is a link where you can just order what you need, and then it will just be delivered straight to your surgery. Yeah, or
Brilliant.
Yeah, so I'll just pop my email address in, and then if you just send me an email, I can send that link to you, so that and then anybody can just order resources.
Well, Danielle, what would be useful, because we've got your email address on this slide, could you share, if you just share the link, then we can get Stephanie to circulate that out with the rest of the meeting here.
Yeah, I'll have a little look. The other thing.
Oh, sorry.
Sorry, just the other thing to mention is there is a digital. I'll send you a digital copy as well that you can send out of the leaflet.
Thank you. Manuel?
Hi, a quick question. I was actually referred by my GP to a similar service because the EMIS picked me up as eligible for the service. But when I actually filled in the online sort of the questionnaire, I was told that I'm not pre-diabetic, and I was so I'm just wondering. The question is there a different criteria from EMIS to your system? Or
that's interesting. That would be a question for Andrea.
Not that I'm aware of, or if there is, I think we need to have a look at it, because they should both align and be the same.
Yeah, so I think I might be able to shed some light on it. I think as a GP surgery, if anybody has ever had a HbA1c that's in that range, we diagnose them as being pre-diabetic. But I think for the purpose of your service, if the HbA1c 2 years ago was 48, but in the last 12 months was 38, they wouldn't be eligible for your service.
Correct.
I think that's the reason.
Thank you. That's good to know.
So I'm safe now, yeah?
Yeah, I think keep doing. I think you could. The thing is, we can still signpost the patients to the service so that they can still pick up things from there. But I think they're not eligible for the program. So I think that your website has certain other lifestyle things that they can change themselves, that they don't necessarily need to be part of the program. So we can still signpost them to the website to do those lifestyle changes, and hopefully that when we're monitoring them in primary care, it doesn't go, the HbA1c doesn't rise back up, in which case then we can send them to you for the program.
Yeah.
Okay. Does anybody have any other questions? No? Okay. Thank you both for joining us.
Thanks
for having us. Yes, and I'll send the. I can send. Shall I send the? Because the link is, there's quite a few different links depending on what material, marketing materials you want to order. So should I send it to one person and then?
Yeah, so I'll ask Steph. If Steph can email you, and then you can reply back to her with all of the links. That would be great.
That's great.
Thank you. Okay, thanks everybody.
Thank you.
Thank you. So, Rima, is Rima still?
Yeah, hi everyone.
Rima.
I think one of the things I was going to mention was the IT issue, but I think that's already been covered. The other thing was there's been a form that's been sent out from the ELF Children's Services for referrals for autism diagnosis. So I think Bipinda actually mentioned this, raises with me, that they had introduced a new form. It was on EMIS. And there's been some feedback to say that there are kind of long sections that need to be filled out. They've taken that back. I think Sunitha and Emma have been liaising with the team at ELFT and to give some of that feedback. But we've been advised that the old form is still acceptable. So if you're finding that the new form is, a bit too long, please, feedback, give any comments, but please also use the old form because they'll still accept it because it's there as a pilot. I think that's it. There's nothing else, but I'm here to answer any questions. I think the IT thing was the main thing. So I think if anyone wanted to continue that conversation, or I understand that Atlas will take some of those questions away and contact Osman about it. Bipinda, did you want to come in?
Yeah, just want to say thanks for raising that, Rima, really helpful. The system they've invented would mean a GP would spend half an hour filling in name details, all that kind of system. I mean, it's, who in their right mind would think of essentially a digital system that suited them, but would mean essentially a manual system for us.
Yeah.
Don't get anybody would invent something without consultation or partnership. Surely they should have a GP on the panel, and there are perfectly good systems around. There's ERS, and we've got EMIS referral to MSK. They could build on what's already working rather than come up with something new. So thank you so much, Rima, for raising it, because it has a big impact on us. Thank you.
Yeah, thank you. Any questions or comments, anything that anyone wants to raise today?
So Rima, I have one question for you.
Yeah.
So this week, I've been getting more clinic letters from secondary care asking me to do a referral to another service or a linked service. So do we have something documented? Because my understanding was that if you refer a patient to gastro for stomach pain and the gastroenterologist feels that the patient's needs a second opinion from a different consultant, but it's with regards to the stomach problem, then they have to do the referral. But if, for example, the patient happens to mention I've got an earache, then I would need to deal with that.
Yeah.
So I've been getting more than usual this week. So I don't know if there's something written somewhere where I can send that work back to secondary care.
So I'm glad that you mentioned that, because there are different ways that consultants are working. So some departments are doing one thing, and even within that group, there are consultants. Now, part of the primary care forward plan, there are 4 criteria that we're working with secondary care. So one of them is for them to do electronic fit notes. One of them is to do consultant referrals. And then there are a couple of others. So we have set up a primary secondary care interface group, which is going to be looking at these things. But if you could let me know which specialities they were, that'd be helpful for me, because then, do you know if it was a Newham hospital or was it at?
Yes, Newham.
It was at Newham. So I can then just take that back to Liat, because then she can have a word with those departments, because they should be doing those consultant referral. Now, their excuse is they don't have the IT to be able to do that. So everything has to be logged from their end. They're saying that everything needs to be logged through ERS so that they can track the referrals. Now, within Bart's trust, they don't have that system in place. And I think that's why there are more coming back, because they've been told that everything needs to go through ERS. But if you let me know the specialities, then I will feed that back so that Liat can talk to the teams. But we're going to have representation of each of the departments on that interface group, divisional representation.
Okay, and I think we've got a question from Laura that says, can you tell us about the email from Sarah C we received this morning regarding primary care transformation? Laura, we may not.
Did you not get it? Okay. I'm not aware of it.
Don't worry. It was an email. It was sent from Nell Primary Care, and it says invitation to participate in financially compensated engagement workshops informing primary care transformation in London. Is a long old email, so I can't sort of talk about it verbatim, but it says it's sort of wanting to talk to lots of different departments about primary care transformation, and it wants people to get back to see if they can participate in 2-hour workshops. But it would be interesting to see, who's being consulted, what's the agenda, have decisions been made already, and this is just to tell us rather than to ask us. And I would really want to see if, LMC have been formally invited and all of that stuff, rather than, like you say, random people maybe being invited to this.
Okay, thanks, Laura.
I can forward you the email, Rima.
Yeah, if you don't mind. You can see from my face, I have no idea where
no
this has come from. So
could you forward me the email as well? Just could you forward me the email as well, because I have not seen it either.
No problem.
I just put in the chat now. Have a look.
Thank you. I don't
think I can put it in the chat, but I'll forward it. But yeah, it's not ideal. I'll forward it now.
I wonder whether this is a London-wide or a North East London, because usually in North East London, transformation primary care would come from within the now primary care team, and Aklasur would be kind of aware of that before. But if this is a London-wide, then obviously that's kind of probably slipped through the net.
I think it is, Rima, because it references that it's working with the London ICBs, the 5 London ICBs.
Right.
And I received a copy and was asked to forward it to clinical directors, which I have done.
You put it in the chat. Well done, thanks.
With the ask that clinical directors might wish to involve PCNs. So obviously, in that sense.
Okay. So it's gone straight to so it's gone to yourself, and then via yourself, then you forwarded it on to CDs. Is that right, Karen?
Yeah, but it's gone. So I received it this morning, but it's obviously gone to other routes as well. So I'm assuming I was one of many, but I was specifically asked to forward it to primary care leads in PCNs. So clinical directors.
I do think it should go to practices as well, though, because CDs might not always pass it on. And it does say it's to NEL GP practices, but obviously not all NEL GP practices received it, which isn't ideal. And certainly it doesn't sound like our local LMC has received either. So, yeah.
Okay. Aklasur, are you okay to take that away as well, just to speak to, if you have meetings with Sarah, just to find out what.
Sure.
Yeah. Okay. Thank you.
If someone can forward me the actual email, that'd be really
I'll
helpful.
do it.
Please, thank you.
Are you going to do it, Karen?
Yeah, I've just done that. That's fine.
Okay, no worries.
Thank you.
Okay,
Yeah, so
any other?
I've just got the email in front of me. It's been sent to the GP surgery email. So it's gone to the generic email address for the GP practices, but it's also gone to the GP partners, it looks like.
Okay.
And
I've got
it has also been sent to the PCNs as well. Yeah, so we've received it as well as PCN.
Okay. I guess it'll be interesting to understand the context of the letter and what they're actually asking for. So I'll have a look.
Thanks, Rima. Any other questions or comments for Rima? Okay. All right, anything for anybody? No, I think we're all just busy thinking about getting back to work, aren't we? Right, so everybody have a good rest of the day and have a lovely weekend. And I hope for myself and for the others that are affected, our week next week is better than this week has been. So take care, everybody, and have a good weekend.
Thank you. And whoever wants to stick around and give me some pointers around the IT, I can collate it and I'll ping that email over.
Yeah, I have a question. One of the questions is what the practices who, the partners or GPs who also connected from home with their home Wi-Fi encountered a similar sort of experience. So I'm wondering whether when they log in remotely, are they logging in, are their remote access being routed through their practices, or whether it's being routed through their VPN private home network. So that's another thing. Other thing that we need to.
It should be via their VPN because that's the way to do it. It should be, but yeah, I'll ask that question.
Yeah. Because I was involved in it because two of my practice or my PCN practices were affected by this, and so I was trying to support them, see how we can sort of pool resources as a PCN, and also I spoke to NHC to see if we can adjust our enhanced access to provide additional resources, appointments for them. So that is when I said, well, you got laptops, why can't you work from home? And the reply was, it's the same. So that is when it made me think whether the VPN routing is actually through their practices or whether. So we need to find that out as well, because that shouldn't happen.
It shouldn't be. It shouldn't be at all, because even regardless of the internet source, your connection is always via the VPN. Unless you're connected via VPN, EMIS doesn't allow you to connect.
No. They can connect. They're connected via the VPN, but what we need to do is whether that connection is through their practice.
No, it will be through whatever internet you thought you connected to.
So that was another issue, because the practices did report back. They couldn't even. They had the similar problem even when they connected from home.
Yeah. So from my understanding, the VPN allows you to connect directly to HSCN, so you should have direct connect. There shouldn't be any issues. But I'll put that as one of the queries anyway.
Yeah, I understand, but technically the routing could be, connecting to HSCN network is one thing, but the internal at the technical. Sorry, I'm being very technical, but the routing of the connection is what we need to understand, whether this connection is being routed in a way that it is routed through their practice as well, HSCN practice routing, or whether it is an independent sort of routing via a different. That's what we need to understand. Sorry, I'm asking a lot of technical questions because.
No, that's fine. If they want me to expand on it, I'll be.
Just get in touch with me. Yeah.
Okay. Anything else to take away?
So from my side, there's no. What we did is with my one laptop, I sat in the surgery, connected to the NHS Wi-Fi, so the public NHS Wi-Fi, which was running on the backup line. So I didn't work from home. I did it from the surgery with the laptop. But my issue was that I only had one laptop.
And Alpana, that's probably why you were able to manage, because you only had one laptop. So if you had several laptops, you probably wouldn't have been able to have done it at all, because the wire for the backup line is rubbish. It's really flimsy, so you're not going to get the the bandwidth that you need. So your one laptop is just about struggling to do it, and even as you're connecting now, you're sticky for me.
Yeah, so that's what we've tried as well, and we found that the connection kept dropping. So when the admin team and the clinicians would log on using their laptops within the surgery, it would keep dropping. Even when we were hotspotting out off our mobile phones and things, just, you know, the connection would drop and EMIS would crash. Yeah, it was a real big struggle yesterday.
From what I understand, if you're using your laptop in the practice, that's sharing the same main line or the backup line. So the laptop in the practice is not of any value unless you use a laptop using your phone to connect outside. You know, if you use it as a hotspot. So the Wi-Fi in the practices has also gone down because it's using the same lines that have been cut.
The backup line, yeah.
Yeah,
so I think Tammy's right. I think the only reason I was able was one laptop.
Yeah, that is where people who have used the hotspot or other outside network also experience the similar problem. So this is why we need to look at how these connections, VPN connections, are actually routed. Are they being routed directly to a different server, different connections, or whether the HSCN routes it through the practice routing mapping?
It's not the VPN. The VPN always goes to EMIS. But the key thing is how you're getting to the internet. If you're using your laptop in the practice and using the NHS Wi-Fi, you're still using the same lines that have been cut. But if you use your hotspot, like your phone as a hotspot with your laptop, then you will get a connection because you're bypassing the broken line. The VPN always goes to the EMIS server, and they
I think yeah, so I think there's issues with that as well, because it might be that the network you're using with your hotspot isn't strong enough to run it, and similarly at home as well. So I think
the hotspot isn't strong enough, Aklasur. So you're absolutely right. It's not good enough because EMIS is a very fat software. It needs quite a lot of bandwidth.
Yeah.
And that's where people are struggling. But I mean, you know, I think one practice with what has been restored, they're all still disconnected on day 7. Today's day 8. Because Thursday night it happened. And is there any more practices they're going to cut off? That's my biggest anxiety.
No, so from the comms, it suggests that it's only those 11 practices that have been affected. As I said, I wasn't like, from primary care perspective, we weren't aware of it until later on Tuesday when one of the practices reached out. And then we're getting comms saying that it's more than just one practice, 11 practices. So as I said, obviously the IT guys are working to resolve it or come up with a solution. I don't know how quickly they're going to resolve it.
So
we've been given 10 days lead time in one of the comms. But again, I'm going to touch base with them to say, you know, what does that mean? With regards to comms to patients as well, I think we need to get something out there as soon as possible as well, because they're going to be, you know, frustrated, etc. So the impact will be all of the obviously practices, but staff as well, patients as well. So we just need to factor all of those things in.
So the 10 days is Ofcom ruling. When you order a BT line, I got this from Phil Woolley. I had a long chat with him.
Right.
10 days from the placing the order for it to be installed. There's a 10-day cooling off period. That's an Ofcom sort of national. Now, if those orders were placed on Tuesday or Wednesday, that means they won't get any access until the end of next week.
Okay. So what we're going to try and do is understand what happened and try and expedite it best as we can. But you know, at the moment, until I've had that conversation, I wouldn't really know. So I'll take that away and then we can pick it up. But if there's any other issues we haven't already discussed, it might be useful to mention.
Well, can I ask another question? Sorry, Gopind, go on.
No, just we need to, what else we can do to support the sites. We can offer premises, we can offer laptops, but laptops on the site won't work. So the only face-to-face appointments, they have to go to another SAT practice. And they can work from other practices and do their phone calls. They can't download online consultation forms. They must have thousands backed up. So if it's 10 days, is it 10 working days? Because then it will be another 2 weeks from Wednesday when it were ordered. So that'll be another 2 weeks. Or is it 10 normal days? So this thing is, we're only mid-crisis point. So the problem is so big, and it's 100,000 patients of Newham or more, because it's literally a quarter of Newham's patients have been affected. Okay. Sorry, not making your matters worse. I'm just trying to describe.
No, it's fine. All it is, it's just, you know, I'll need to see clarity around the 10 days. And then I think what might be useful is trying to understand what all the practice issues are. And obviously everyone's got a BCP plan in place, etc. But where we can support, you know, however we can, then we'll try and do that as best as possible. But in terms of laptops and so on, I think without internet connection, getting laptops out there, it won't be the best solution. It's about getting the internet into sites. So yeah, I can have those conversations.
Thank you.
And I think the main thing is a time frame, because then we can plan accordingly. Because at the beginning of the week, we've told patients, oh, should be sorted by the end of the week. We're on Friday and we're still in the same spot. So I think that just having a time frame so we can inform patients accordingly.
Absolutely.
And I was really sad to hear that Sharif's practice have had that barrage of abuse, because, you know, we're working as hard as we can, but you know, understandably, the patients will have a knock-on effect because it's affecting their care.
Yeah.
So just a time frame.
Yeah, and also I want to just go back to, because one of the things that I did was to put it on our PCN chat if the practices can offer any spare spaces. And to be honest with you, they're struggling even to accommodate their ARRS staff, and so there is no space. So even if is there any vacant space that is sitting there and these admin staff can actually go in and work from there, it would be a useful thing. That, you know, we got laptops, we can't connect, we got, you know, we don't have spaces. So luckily, you know, with COVID, we moved on with the technology, so they will be able to work from anywhere with the, you know, Exxon virtual telephony system, and also EMIS being able to, but it's just needs, I'll just mention Central One needs space for the admin staff to actually at least even call the patients to cancel or rebook or reschedule the appointment, and we don't have that space. And you know, thank you to the practices who have offered whatever space they have, and but you know, we're struggling with even placing the ARRS stuff, let alone when something has happened, to actually find space to place these stuff. It would be useful if the redundant spaces are just sitting there, or whether it could be opened up in these cases like this to be offered as a.
I can ask around void space, but it will come back to whether there's internet on that site. And to be honest, I don't know. So I will ask around void space around the area.
Yeah, we've got 5 desks at Glen Road upstairs you're welcome to use. That's Central One, Manuel, if you want to call us.
Okay, thank you. I will put that up. I will put it on the chat. Yeah.
We've got an empty office upstairs in Glen Road. Anybody can come and use it. Yeah. And because they're going to use, you know, Exxon and stuff, so they can use it on the computers. We've got 5 computers upstairs. You're most welcome to come and use any time.
Okay. Can you put the contact number so that the practices are already on the call, so that they will contact them and arrange if they need? But thank you, Bhupinder. Thank you.
Where do you want me to put that?
Just put it on the chat. If you don't, send it to me. If you don't want to put it there, send it to me.
I'll send it to you. Yeah.
Yeah, send it to me, and I will share it with the the practices who are affected in Central One. Thank you.
Sharif, then Sabir, and then I think that, because I think we can talk about this for hours, so I think that we should all actually get back. So Sharif, and then Dr. Sen.
Thanks, Apna. I think just from a practical solutions point of view, I just wanted to highlight that, you know, I've tried the EE dongle for my laptop. I've tried logging in from home, which is high-speed broadband fiber. And it doesn't work. I can work for my Shrewsbury practice absolutely fine. We're using the same laptop, but struggle when I log on to Newham Medical Centre. I'm not quite technical, so I don't know what that means, and what Manuel was saying about, I don't know how the networking, routing, all of that works. Maybe that's something, but whatever practical solutions that Aklasur, you guys can offer us, please just bear that in mind, because if we just get lots of laptops with dongles and we still struggle come Monday, I'm not quite sure what that.
Dr. Singh?
I think his bandwidth gave up. So look, I'll try and get solution in place soon as possible. I'm not sure whether he'll be in place by Monday, but I'll speak to the IT guys and pick it up. Things to be.
Yeah. So Bhupinder, are you still in the line? I just wanted to ask Bhupinder, thank you for offering these 5 desks. Is it still available over the weekend? I'm just worried about number of lab results and number of documents accessed that might cause a patient safety issue. So are they available to avail on weekend as well, Bhupinder?
Okay, here's Rupak, he'll tell you.
Yes, it's available, doctor. Yeah.
Saturday and Sunday?
Yeah, Saturday, Sunday, yeah, is available.
Yeah.
So I'll just tell all the practices, please prioritize all the documents and the lab results which might concern the patient safety. And that might be and whistleblowing. We don't want those kind of things in Newham now.
Yeah, so just contact Rupak. He's got 5 desks here upstairs to use in Glen Road. And there's also 2 desks, three desks in Cumberland Medical Centre upstairs, which are hardly used. So you're welcome to come and use them. The internet's good. But Rupak's your man, yeah, he'll contact. You got his number, Manuel, he knows you well. So Rupak's your contact. Thank you.
Thanks, Bhupinder. That's really kind of you. Okay, right. I think, thank you, Aklas, for staying on and listening to us. I'm sure we could go on forever, but anything that you can do to help us would be much appreciated. So thanks.
No worries.
Okay, everybody, have a good weekend.
Bye, everyone. Bye-bye.
Bye.